Good evening. We begin with breaking news. Today, confirmation, the first case of the coronavirus on the East Coast of the United States. Also tonight, the Defense Department is designating military bases across the country that could house 1,000 quarantine patients. More coronavirus deaths, too, so far all in China. And it's having a major impact on travel. Airlines canceling flights and the government banning those who visited China from entry to the United States. NBC's Sarah Harmon has the latest from March Air Reserve Base in California.
Tonight, a rapidly evolving public health emergency, with Massachusetts confirming its first case of coronavirus in Boston, the 8th in the U.S. so far. The patient, a UMass Boston student in his 20s who visited Wuhan, China. The Department of Defense approving future quarantine centers at military bases across the country, with space for the nearly 1,000 Americans still stuck in Wuhan. Starting tomorrow, the government will enact its strictest measures yet.
They told us to monitor ourselves, and if we feel any symptoms at all, to report it through the CDC.
Banning most foreigners who visited China recently from entering the United States, and requiring Americans who visited Hubei province to undergo a 14-day quarantine, including the 195 Americans evacuated earlier this week. Delta Airlines accelerating plans, halting all flights to and from China after Sunday.
We're nowhere near as prepared as we need to be. There are weaknesses both within the U.S., but especially around the world.
So far, at least 14,000 people are infected in 24 countries. But concern is growing the true number could be much higher. A new study predicts as many as 75,000 people could be infected in Wuhan alone.
It's certainly much less severe than SARS. On the other hand, it's spreading more rapidly than SARS spread.
The rapid rise in infection alarming officials.
We're really probably at the tip of the iceberg in understanding how contagious it really might be.
Around the world, the race to halt the spread is on, as fear spreads in the U.S. that coronavirus may soon reach a tipping point.
Breaking news now, we are following the coronavirus outbreak, a new case in the United States. It's in Massachusetts. It's that state's first and involves a man who had recently traveled from China to the United States. That makes 8 confirmed cases in the United States. The federal government on Friday declaring a public health emergency. Globally now, 21 countries have confirmed cases of the disease. The outbreak first reported on December the 31st in the city of Wuhan, China. Quickly spread to the rest of the mainland, which now has 11,791 confirmed cases of the disease. 259 people in that country have died. Joining me now is NBC News correspondent Sarah Harmon, who is monitoring this story. Sarah, we saw members of the president's task force on the coronavirus, all men, I should point out, a 12-member team entirely comprised of men, coming out to the lectern at the White House yesterday to field questions on the strategy going forward. What is the White House saying? What's the administration saying about how they're handling this outbreak at this time?
Hey, David. Well, the administration is taking some bold new steps. First of all, they're calling this a public health emergency. And beginning tomorrow at 5 p.m., there's going to be some rather drastic measures at the border. Any foreign national who has visited China in the last 2 weeks is not going to be able to come into the United States, with a few very notable exceptions for next of kin of American citizens. It's a bold step, and what we're seeing is authorities trying to get out in front of this virus before it reaches a tipping point. We're here in California at March Air Reserve Base. Here behind me, this is where they're holding the almost 200 American citizens who were evacuated from the epicenter, from Wuhan. They're now being held here, David. When they arrived on Wednesday, the expectation was this is going to be a relatively short period of quarantine, and then they'll be back off home. Not anymore. Now they are under a mandatory lockdown order for 14 days because authorities and health officials are telling us they don't yet fully understand how long people are contagious for and whether or not they can spread the virus even if they're not symptomatic. So, safety first, 195 American citizens still on lockdown behind me as public health officials work to get out in front of coronavirus. An 8th case confirmed today. Not great news, Dave.
The U.S. takes an aggressive step to slow the outbreak.
Beginning at 5 p.m. Eastern Standard Time, Sunday, February the 2nd, the United States government will implement temporary measures to increase our abilities to detect and contain the coronavirus proactively and aggressively.
Measures that will include a mandatory 14-day quarantine for any American citizen who has traveled from China's Wuhan province, the epicenter of the outbreak. Those who have traveled from mainland China will undergo monitoring and self-quarantine for 2 weeks, but that's only for U.S. citizens.
Foreign nationals, other than immediate family of U.S. citizens and permanent residents who have traveled in China within the last 14 days, will be denied entry into the United States.
Government health officials say while the outbreak risk in the U.S. is low, these steps are necessary.
But I want to emphasize that the risk to the American public currently is low. Our goal is to do all we can do to keep it that way.
This is not something that's being transmitted from person to person, place to place. This is not something you're seeing at the grocery store, at the movie theater, at ball games, or anything like that. This was close contact within the same household.
Public health officials advise the flu virus is a bigger threat to this country than the coronavirus. So washing hands and covering a cough, the best way to prevent getting sick.
American Airlines has also canceled some Hong Kong flights this weekend over fears of the coronavirus. It's just one way that the illness is having an impact on the stock market. U.S. markets tumbled Friday because of concerns of the outbreak that it could continue to grow across the globe. The Dow sank over 600 points. The S&P 500 dropped 58 points. And the Nasdaq sank 148 points. It was the worst day for the Dow since August, following what had been a solid start for the year on Wall Street. For more, I want to bring in Akiko Fujita. She's a reporter for Yahoo Finance. So Akiko, explain to us exactly why the coronavirus is causing this big drop.
Yeah, when you think several weeks ago when the first strains or first cases of coronavirus were reported, it was largely seen as an issue that was on mainland China. What we saw yesterday, as Rami pointed to, were airlines coming out and saying they will no longer be operating or at least temporarily suspending flights to mainland China. We, of course, got that designation from the World Health Organization calling this a global health emergency. And so what we're now realizing, at least investors, are that this is something that is no longer just contained to China. We now have 18 different countries reporting this. And when you look at the stock moves yesterday, we certainly saw the airlines being particularly hit, given that a lot of this travel to the world's second largest market has pretty much been halted.
On Thursday, we saw Commerce Secretary Wilbur Ross, who spoke on Fox Business, say that he thinks the coronavirus could actually help bring jobs to the U.S.
Groundbreaking drug has just been approved to help ease the severe and sometimes deadly reactions from eating or even being near peanuts. Erin McLaughlin has the details.
Tonight, for millions of families with children suffering from peanut allergies, a major breakthrough. On Friday, the FDA approved the first treatment for kids between the ages of 4 to 17. Palforzia is not a cure, but it could save lives. Dr. Christina Chacho was a paid consultant for the clinical trial.
We're actually giving children a tiny bit of peanut, and we're forcing their immune systems to learn how to tolerate it. And by doing so very slowly, we can convince the immune system to not react to the peanut.
Across the country, an alarming number of kids going to the ER with dangerous reactions to food. More than 40% of children with food allergies have experienced a severe allergic reaction.
I would get really, really nauseous, and I'd have like an itchy throat and my face would swell up.
Last fall, NBC's Kristen Dahlgren spoke with Violet Misio and her mother. Violet has a severe allergy to peanuts.
I couldn't even touch doorknobs sometimes. I just had to wipe them down before, because somebody could have walked in with peanuts on their hands.
Violet was part of the clinical trial for the peanut pill. Her parents had to monitor for any reaction.
It was well worth it, but I'm not going to lie, it was stressful.
Now Violet's off Palforzia. She eats 2 peanut M&Ms each night for maintenance. Story that offers hope for other food allergy treatments, not just peanuts.
We're excited about it because we've proved that we can actually do this for food allergies. So now we just need to go back down the same pathway and see if we can do this for other foods people are allergic to as well.
And Erin, the FDA has actual guidelines for people who are considering taking this pill.
That's right. And those guidelines are strict. For example, the first dose must be administered in a certified healthcare center. Any adverse reactions have to be reported to the FDA.
Erin McLaughlin, thank you very much.